BioFirst Concept, a new instance to create ideas that converge to the integral well-being of our patients. This is our invitation. The great paradigm shift in medicine and dentistry in recent years are not the scanner, the PET scan, or the functional brain MRI. That is technology. Although they are spectacular innovations, they are just technological tools. On the other hand, both in medicine and dentistry, we have spent the last 2 centuries studying diseases, classifying pathologies, deciding almost everything from the abnormal. We have created diagnostic and treatment protocols based on these pathologies. We have even created scientific societies and specialties: pain, trauma, diabetes, and subspecialties, obesity, sleep apnea, dysfunction, based on these pathologies and also based on technologies and associated techniques. Think in laparoscopy or arthroscopy, or nearer to us, implantology, everything based on pathologies and technologies. And the truth is that we have taken this to all levels because it has become common for us to apply standardized treatments to all our patients. We use the material we have, the implant we learned, the prescription bracket we use, the plates and screws that we have. And we do this knowing that is not always what perhaps our patients may require. However, it is what we have available. It is what I have in my private practice or in my hospital. And finally, it is what I have always done. But now, what is truly important, the real paradigm shift that we have in front, is that today, thanks to these technologies, for the first time, we are really seeing our patients with their biological tissues and how they interact in functional balance or dysfunction. The paradigm shift then is that today we can study and treat our patient as an individual based on their own biopsychosocial reality and how he or she adapts to their functions, their emotions, and their interactions with the environment. Perhaps, having this knowledge, in some cases, we will come to the conclusion that it is better not to treat the patient if I do not have the right tool for their biological reality. It is up to us to worry about the biological aspects of the gnatic system and how the tissues, bone, gums, articular cartilage, muscles, its structures and systems, masticatory, respiratory, psychoemotional, adapt and interact with the functions they perform. So the BioFirst Concept purpose is to generate algorithms and protocols that all allow the specialists to realize that what is important is not our specialty. It is not us or the treatments that we have created. In our concept, we do not believe in dogmas of what it should be. The only thing that matters is our patient and his individuality. For this reason, we will use a powerful, interdisciplinary, inclusive, and at the same time, simple philosophy so that everyone embraces the concept that the patient and his morphofunctional reality determine the terrain we have, and his biological availability marks the frontiers of the treatments that we will generate for them. Basically, we are encompassing many ideas, lines of works in orthodontics, rehabilitation, periodontics surgery that we have seen are stable over time. That is why the concept is BioFirst, and the idea is to work oriented to the individual structural biological limits of our patients at the time of diagnosis and setting their treatment goals, using clinical and technological tools that are available, trying to make them easily accessible.